Abnormal blood sugar levels and prediabetes are early warning signs that your health is on a precarious edge. These conditions, often silent and unnoticed, are significant precursors to the development of type 2 diabetes mellitus, a chronic disease with severe health implications. However, there's a silver lining in the form of GLP-1 agonists, a class of medications that not only help manage blood sugar levels but also offer cardiovascular benefits and slow the progression to full-blown diabetes. Abnormal blood sugar levels, even in the prediabetes stage, can start to affect your health negatively in several ways. Prediabetes is a critical stage where intervention can significantly alter the course of health. Without intervention, many individuals with prediabetes will develop type 2 diabetes within a few years. Even before diabetes is diagnosed, abnormal blood sugar levels can damage your cardiovascular system, increasing the risk of heart disease and stroke. High blood sugar levels can begin to damage the nerves and small blood vessels, leading to complications such as neuropathy, kidney damage, and impaired vision. GLP-1, glucagon-like peptide-1 agonists are a revolutionary class of medications that mimic the action of the GLP-1 hormone, which is naturally produced in the body. These medications offer several benefits for individuals with abnormal blood sugar levels or prediabetes. GLP-1 agonists help lower blood sugar levels by enhancing insulin secretion, reducing the liver's glucose production, and slowing gastric emptying. Many GLP-1 agonists have the added benefit of promoting weight loss, which can be particularly beneficial for individuals with prediabetes looking to reduce their risk of progressing to type 2 diabetes. Research has shown that GLP-1 agonists can reduce the risk of major cardiovascular events, such as heart attack and stroke, making them an excellent choice for individuals with prediabetes who are at increased risk of heart disease. Perhaps most importantly, GLP-1 agonists have been shown to dramatically slow the progression from prediabetes to diabetes mellitus. By addressing the underlying issues of insulin resistance and inadequate insulin secretion, these medications can help maintain healthier blood sugar levels and delay or even prevent the onset of type 2 diabetes. In conclusion, abnormal blood sugar levels and prediabetes are not just warning signs but opportunities to take proactive steps towards better health. GLP-1 agonists represent a powerful tool in this journey, offering not just improved blood sugar control but also significant cardiovascular benefits and the potential to change the trajectory from prediabetes to a healthier future. To learn more, please call our office today and schedule an appointment. Your life may depend on it.